I've personally taken care of over 12,000 patients while working in an emergency department as a physician assistant, as a physician associate. I've been tracking my patient numbers with a spreadsheet, and my wife jokes that I have a spreadsheet for everything. I have 5 things that I want to share with you guys about what I've learned after these 12,000 patient interactions about the emergency department and humanity as a whole.
Wow. That's pretty deep.
If you guys work in an ER and want to share your thoughts, you can also leave a comment down below. First simple lesson I learned after 12,000 ER interactions is to not do drugs. And I know I sound like some sort of dare police officer going into a school telling kids, don't do drugs, kids. I have cared for people who have died after a line of cocaine. I've seen horrendous, disfiguring wounds from IV drug abuse. I've seen drug use lead to young people needing open heart surgery to replace their heart valves. I've seen people abusing alcohol, coming in arrested for their DUIs, coming in with pancreatitis, the people that mess up their livers and have all of these complications because of their drinking. We all know of the frequent flyers with intractable vomiting due to their daily marijuana use. I've seen patients miss so many days of work because they're always sick, they're always in the ER, they're always seeking care, and that results in them not being able to hold a job, and it does affect their life significantly. I've seen bath salts, PCP, horse tranquilizers. I've had numerous patients trying to get high in the bathroom. The best way to avoid harm to your health, finances, social standing, and also to avoid legal consequences is to not partake. And I know that dealing with addiction is hard, and finding resources and help for addiction is very difficult as well. I'm not trying to shame people by bringing this point up first. I'm just more so trying to highlight that there are an immense amount of consequences, and we see that in the ER. The second thing I've learned from my time working in the ER so far is that mental health care and mental health overall in the US is still an afterthought. A lot of hospitals do not have psychiatric care, and in our part of the state, we transfer patients to specialized crisis centers or psych facilities. In theory, that's great. You have one place where they are ready to deal with a mental health crisis or your psychiatric emergency. But the process to get people to the right location, even if they're in an emergency crisis situation, can sometimes take hours or even days. And I've seen patients waiting months to even just try and talk to a therapist or a psychiatrist. This is why today's video sponsor is, I'm just kidding, nobody sponsors me. Psychiatric illness that goes untreated for long enough becomes a burden on families, the community, and even the criminal justice system. I mean, I've seen kids on Snapchatting their friends their suicidal thoughts. I've seen, people doing dances on TikTok about their depression. Just understand that there are still huge gaps and deficits in the United States. The third thing I've learned from my 12,000 patient interactions in the emergency department is that medical literacy is in the toilet. We have people coming in after having a cough for 10 minutes or some sinus congestion, and they've literally tried nothing at home. I'm not talking about the person who has cancer, is severely immunocompromised, has a neutropenic fever. No, I'm talking about 20-year-old kids that just don't have mom and dad to take care of them anymore and don't know what to do. It's almost like there's an entire section in the pharmacy dedicated to cough and cold symptoms and various other over-the-counter remedies for a wide variety of ailments. Americans should know how to address a cold, how to bandage a cut, or how to clean a wound. And if you are on medications, you should know why you're on those medications, how to take those medications, more information pertinent to the things that you are doing for your health. I think overall, I'm not sure, are we still teaching these things in school, or are we just reliant on the Boy Scouts and Girl Scouts of America to fill these sorts of gaps? For your reading enjoyment, the New York Times actually did a recent piece on first aid basics, which I will link in the video description down below because I found it somewhat insightful. After COVID, there has been a significant change in patients, and patients have become severely more entitled. I'm not going to go into any specific patient cases because I would say a lot of bad things and that would get me fired. I think people should realize that as a healthcare provider, we are trying to be on the same team as you. We are trying to be advocates of your care. If we think you should do a procedure but you refuse, we'll let you know why you should reconsider. And if you want something that we don't think is needed, we should also speak up and tell you why. Working in an ER means that we are stewards of healthcare resources, and there's only a finite amount of everything. Just because a patient wants to stay in the hospital, they want a certain medication, imaging test, blood test, doesn't mean that it's always appropriate for that specific circumstance. And people oftentimes forget that an emergency department looks at everything from the lens of who needs emergent care and who does not. My insight for this tip would be that if you are coming to an ER, it's not an emergency, but you have expectations or you're really worried about something, be prepared to have a discussion. I find that those who are calm and reasonable, there are numerous times where the ER can meet their healthcare needs and expectations, but for all the people that come into an ER and act like it's a hotel or act like it's Burger King, that is not the right approach to coming into an ER, and coming to an ER for nonsense and then complaining after the fact is also a senseless endeavor. My last comment about what I've learned after 12,000 patient encounters, and it is somewhat grim, but working in an ER has reminded me that we all need to prepare for our own death. We will all die someday. Every single one of us watching this video, you should tell those who you love and appreciate that you love them today, because tomorrow is never guaranteed.